So statistics by the Narcotics Control Board has revealed that about 70% youth from the junior and senior high schools are facing the risk of drugs abuse here in our country, and that's a very scary situation. If you've got children, they've got more scarier statistics to share with us. A recent Well-Drug report by the UN Office on Drugs and Crime also showed that 21.5% of Ghanaians aged between 15 to 64 smoked marijuana or used another cannabis product. So at this point, if you've got teenage children, you should be thinking, are they possibly on any of these drugs? So we're going to have a great conversation. If you're a guardian, if you're a parent, this is definitely a conversation for you. Mabel Jedu is from the Education and Counseling Units of NACOP, Greater Accra Region. Also, the head of Addictive Disease Units under the Department of Psychiatry with the Kolebu Teaching Hospital, Mr. Logosu Amegashi, is here. Good morning to you. Thanks for being here.
Good morning. Good morning.
When you think about young people, and you think drugs, because usually when you think about drugs, when you think about marijuana, you're thinking is the big boys who do it. But when you look at the statistics, for a parent, it's very scary. How worried should we be as parents?
Yeah, we really have to be worried. But the whole idea that it's for big people should have been erased about some 20 years back. Because cannabis, marijuana use, and alcohol use, in the early ages, alcohol was a preserve for people who are old. They use it, but currently, about 20 years back, the trend of drug use has changed. And the reasons are varied. So many reasons, the proliferation of internet, a whole lot of things are being viewed by our youth on the TV, and the idea of curiosity, wanting to find out what that person, the things, association of good life and good cars with people who are in certain industries, and the knowledge that they are using these things, but they have these things, entice them to also want to have those things. That association, psychological association, makes them to experiment the use of drug at a very early age.
How early are we looking at?
Now, it depends upon where I am in the rehabilitation center.
Okay.
So there was some time, as far back as 1993, I had a girl at the age of 8 who knows how to smoke cannabis, because he has been sent by the men at the trade railway line there over the years, and interacting with her, it was not only in the use of the cannabis, they were sexually assaulting her too. That was years back. But when you look at it in recent times, we go to school sometimes to administer some questionnaire, anonymous questionnaires, and you realize that most of them below the age of 12 knows how to use cannabis. I'm
curious, how do they get introduced?
Yeah, that's what I'm telling you. Older siblings.
People sending them.
Older siblings send them in the house, and in certain homes it is accepted. You know, one of the reasons why people get into drug is the availability, the acceptability is also a component. Let's say, for example, you're in a family that father smokes, son smokes, everybody smokes. Nephews will definitely don't have a problem because it's looked as a normal thing. So it is no longer news when we talk about the youth and drug.
Adding to what Mr. Amegashi is saying, we once visited a school, and after that we called for counseling. One child came and reported that, "Madam, my daddy smokes before us. What should we do?"
Good question.
That is what
because daddy is the head.
That is it. And if we say we complain, it's going to be us. So what should we do? It was a difficult question, but we had to help her out. So it was a primary school.
So we are saying that some parents would even smoke, because we know that cigarettes, I know that cigarette is, like very common that parents can smoke, but to the extent that you're smoking cannabis in front of your children.
He sends them to buy.
They share too.
Wow.
They share. That's how serious it is.
So how prevalent is this? Sharing with the entire family, if you like. Are we doing it a lot these days, would you say, Mr. Amegashi?
Now, I do not have the statistical facts about that, but I meet people who share these things in my clinic. What happens is that we are not going to be able to make it look representative of the entire society.
Sure.
So, yes, it is happening, but data collection in this part of the world is a challenge. And on this day, the drug day that is coming, that is one of the things that some of us, apart from looking at the topic, some of us would want to advocate seriously that there should be some sort of funding for data collection, because it is going to give us an estimate, not the exact number of persons into cannabis, especially the youth, and this is going to even provoke thoughts about planning to meet and a whole lot of things. Without data, it gets difficult, like you know.
So maybe because Mabel is coming from NACOB, she's got some data to share with us. You usually would do the arrest, and what kind of people would you say you are arresting these days?
Oh, that is for the past few months, or maybe say years. It's mostly the youth.
So young people.
Yeah, young people.
Young people.
Yeah.
Young people. Would you, is there a certain age group? Because we've heard from 15 to about 64, they use it.
Yes.
Is it the same statistics for us in Ghana? Because this is the broader statistic from the United Nations.
There's one thing I want to comment on this one. When you look at the data that I had collected over the years at the Addictive Diseases Unit, from 1991 till date, there's an age. They start as early as an average of about 12 years, 11 years. They reach the peak. The majority of the people, the middle class, is between 22 and 29 years. After that, the number reduces. And it is explained scientifically that by the time these people have gotten to 40, 50, they start to have medical complications. They have psychotic complications, or they get involved in some traumatic situation and then they pass on. That is why the curve is like that. So they don't see more people, elder people or older people using drugs. And it is not pertaining to only cannabis and the drugs. It is general for all psychoactive drugs, mind-altering drugs, from alcohol, cocaine, heroin, and the rest.
Ecstasy.
Yes, all those, and including the pharmacological drugs of abuse. So they start early, reach a peak around mid-20, 29, 30 there, and then they start to, some luckily quit, some go to jail, and some die. Because when you are using those drugs, the complications are not necessarily going to be only social. Medical implications are also very important.
So what is commonly used in Ghana? Is it the cannabis?
Yes, cannabis, marijuana, or ecstasy too. That is, they call them club drugs.
Club drugs?
Yes. Most of the youth, they abuse that one. When you go to schools, we hear that they take it, since it's a psychoactive drug, it makes them very active, hyperactive, and do most things they think they can't do without the drugs. Yes, they think that they can give them extra strength, that sometimes they can act over the normal time or the normal frame. They can do maybe dancing or rapping or any other thing, especially some of the musicians.
Now from the clinics, the most drug use is alcohol.
Alcohol?
It's still the
normal
champion.
Alcohol?
Yes. Followed the training, and then followed by cannabis or marijuana. The pharmacological drugs that he's talking of is not yet very representative in the clinics.
Okay.
We have tramadol, we have injection petitine, we have Valium that they call Bama or volume 5 and volume 10. Those are represented in the clinics. And then the trend is now changing. Initially, these are gateway drugs: alcohol, nicotine, marijuana. That's how people start. Usually start with, those who are going to use the hard drugs start with cigarette. They move on to cannabis, then they move on to cocaine, and then they move on to heroin.
Is it because you're looking for something higher at every stage?
At every stage, you get the euphoria. At a certain level, you develop tolerance. You need higher doses or drugs with higher potency to give you the high, the initial euphoria that you have. So they do it that way. But there is a serious thing that is happening. There are people in Ghana now, the young ones, who are not starting from nicotine. They are not starting from marijuana weed. They go straight to cocaine.
And crack.
And crack, that's crack cocaine. They go straight to it. Now, but the old trend was from nicotine, marijuana.
Like you're graduating.
Graduating is a way of graduating, then you get to. But currently, it is very difficult for you to see somebody who is using cocaine and is not using heroin. So multiple drug usage among the youth is the order of the day. The cocaine is a stimulant. And then they say you hit and cool. The heroin is a depressant. So when you ask them, you hit and cool.
Oh, yes.
Now, apart from that, they have combinations. They mix heroin and marijuana.
What effect would you get if you did that?
Well, they enjoy it. It doesn't. The heroin is a depressant. It slows you down completely. The marijuana is it's not a depressant. It's a psychedelic. It makes you hyper. So it balances you. So that when people smoke cocaine as a stimulant, it quickens them. It raises everything. Then they smoke the heroin to slow down so that they are not too hyper. That's
Is that a bad thing?
It is. Initially, the euphoria. What you usually would have to look at the pros and cons of the drug use. Now, what is the benefit of using the drug? Is it only the euphoria? But what are those things that get into using the drug? Therefore, the issue of drug abuse is not necessarily when you are under the influence of the drug. When you get hooked to drugs, the things that will make you do to get the drug, the social implications, the stealing, the selling of yourself, prostitution, homosexuality, we do everything possible to get a drug. Those are the things that we're talking about. So it is not necessarily the consumption. Therefore, drug addiction is not about the consumption of the drug. It is about before usage, the behavior, during the period under the influence of the drug, and post-usage.
Okay.
Those are the things that you need.
Mabel, what do they get the drugs from?
They can get it from the markets. The drugs are in the market. They get it from the market. And also some people produce it. We have some parts of the Greater Accra region and other regions as well. They produce cannabis. That is the mostly or widely abused drug. It is common here in Ghana.
I'm just thinking that the Narcotics Control Board is supposed to be controlling these drugs. So how much of controlling is the board doing?
Oh, we're doing the control. That is the supply reduction. We checking that, especially with the cocaine, heroin, we don't produce it in Ghana. It's from a country and it comes here. So we are at the borders, the airports, and all the
That's when we hear somebody has been arrested
yes,
and things like that.
From not coming into the country. Where the marijuana, it is produced in Ghana here. And a lot of the regions, almost every region, they have a place they produce marijuana in larger quantities. So we are also doing that in sometimes with the enforcement, with the police, we go for raiding and others. We can do it, but it's a corporate thing. Let me say it involves all stakeholders to fight this drug.
So, Mr. Magashi, isn't there anything good at all in these hard drugs?
Now, there's one thing that I would want to always refuse to respond to. That is one. Not necessarily refuse, but then if I were talking to you as a person, a matured person who knows what you are asking, then I would not play that gamble.
No, because we've heard that sometimes some of these drugs are prescribed, correct?
Where?
Hospitals, doctors,
Which
or
hospital?
something. I'm not sure.
Yes,
but
so
I've heard that some of the drugs are prescribed.
That is
yes, that's coming.
That's when some people kind of abuse them.
Yes, that's why I'm coming. The prescription drugs, sometimes, like injection pethidine that people get used to, is an opiate. It belongs to the heroin group. It is supposed to be used for post-operative care. People go to operations, and then they give them to alleviate pain, injection pethidine. But because it's an addictive drug, it is given with control by the doctors. But unfortunately, this drug is abused mostly by our health workers, nurses, doctors, and those who know about it. And unfortunately, this drug is even being introduced to people with sickle cell crisis, those who have burns, in fact, severe pains. So it is a problem, a challenge for the health institutions now. And as we speak, Recovery Ghana is trying to introduce something we call employee-assisted programs, where the health workers with these things will be assisted on the job, not necessarily dismissed, because addiction actually is not a moral issue. It's a disease. People who get hooked whether it's prescription drug or not, he said, there are certain conditions that you suffer. Now, let's say, for example, you have insomnia, you can't sleep, and the doctor gives you Valium. Over a period, you realize that they don't give you for a long time. But people, because of the relief, the quick relief that they get from it, go around and go to pharmacies who are not doing the right thing, and they continue giving it to them. Then they become dependent on it. A drug like Ativan, Lorazepam, Tramadol, they are prescription drugs. The intention of the doctors is not to make you an addict. You see, it is just because people are not doing what they are told to do, or there are people who encourage them to do it ignorantly. So yes, the prescription drugs, people are getting hooked to it. That's why I say people get addicted through treatment.
You know, I've always said, and sometimes I've heard some of the things you hear are kind of bizarre, that people are sniffing petrol now. Is that is that a concern?
It is not on the high scale, but it's there. It's there. Not only in this thing that they used to polish furniture. It's also one. And then there is the
normal
and this thing is also pica. We call those ones pica. It belongs to the group of pica, P-I-C-A. People who eat ayilo.
Yes.
It's pica. It's also an addiction. Addiction is just something that you do to relieve. There's an obsession to do that thing, and you compulsively do it to release some sort of tension and have a euphoria in the presence of consequences, physical, social, psychological, and sometimes even spiritual consequences. You understand? Yeah.
Sure. So Mabel, how do you go about the education? Are you visiting the schools? How early with the classes?
We visit schools, organizations, churches. With the schools, we take from the upper primary, from primary 4 upwards. We go to the tertiary institutions as well, training colleges and every place. Yeah, and even associations, they can call us to give a presentation on the drugs, the harmful effects, as well as the illicit trafficking consequences of it.
Because sometimes you find people who are not necessarily engaged in the smoking or the usage, but they transport it. They carry it from one point to the other.
That is the trafficking.
Yes. Yeah. And they make a lot of money out of it. So it's kind of lucrative. If somebody says, bring it from Ghana to maybe the UK or the US or that kind of thing. I've heard stories about people who entice young ladies, especially those who are in schools, with a lot of money. And sometimes the young ladies don't necessarily need the money. It's just the extra money for shopping. And you find there was a story of this young girl, I mean, not like a senior high school, in one of the international schools. And it wasn't a problem for her to even travel outside the country. It was just for the shopping, you know. And so she swallowed, and there were actually 2, and one of them died because they couldn't tell anybody that they had swallowed something. You know, it was a bit too late.
Yes, they do transport it, as you're saying. That is why I'm saying the youth are at risk. They come, convince you, persuade you with some few dollars. It's not that much. Though it could be much, but it's not that much. Your life is more valuable than that money.
Do you think the young people are listening?
Oh, yeah. They will listen. Now, like, we get feedback and we see that they are really... Sometimes when you go give a presentation, some of the parents will come. We didn't know how dreadful the issue was. We've had it, but we didn't know how. With pictures, we have exhibition pictures as well. We showed to them some people who have been dead through the trafficking. Yes, and some who are not dead, but we caught them. And how they traffic some of the drugs as well. We showed them, and it's like many people, they hear it, but when they see the pictures as well, they think it's a very, let me say, it's a very scary to them. Let me say it that way. It's very scary to them. So they will say, oh, we've really changed our mind, and we'll go educate other people as well as.
Okay. So let me ask Mr. Magaji, so is it so easy to change your mind?
Yes, let me.
And to get off drugs?
Well, I'll come to that one, but let me add up to something that she said. There is a challenge here confronting us as a nation. The perception that addiction is a moral deficiency makes it very difficult for our children to share certain things that they have seen at school. The mention of marijuana or weed it's a whole problem for most of us. So it gives too much worry to parents to the extent that the children would even hear and know certain things that are going on, but they will not share for direction. It is not easy, and it is easy to get out of drugs. There are so many factors that contribute, just like getting into drugs, and the family is one. And it is the same family that must equally help and understand and bring the client or the person out.
Can I just take you back, maybe
Yes.
one step back? How do you know, still with the family, how do
Yes.
you know that your young child is drinking or smoking?
For alcohol, you don't have a problem because the aroma would expose the person. Now, the way the person walks, the gait of the person would also. But for cannabis, let's take it one by one and give some of the highlights.
Okay.
Anybody who is using cannabis, there's something we call the red eye syndrome. The eye becomes red a few minutes after smoking. But unfortunately, the smartness of these are computer children. They have liquids that they ligate the eye, they smoke, and it's white. Now, apart from that, if the red eye is not there, then you need to look at the eyelids. Those who smoke marijuana a few hours or a few minutes after, the eyelids are swollen as if they have just gotten out of a sleep or they have wept. Now, anybody who starts smoking marijuana loses the oil. The oil, the shine of the face goes. As we are staying here now, if you go out to smoke any of the drugs, including marijuana, it will be as if you are in a harmattan, as if you have been powdered.
Oh.
That's one. But apart from that too, you need to watch your children and find out the language that they have started using. The language is one of the things that exposes them. They tend to speak languages, and then they are walking, the style, the way they dress with the eye band. I'm talking about marijuana, eye band, the African map with black, red, and this thing, the red, black, and this thing band.
The bandanas.
And then their sleep pattern changes.
Okay.
The availability among families that they do the morning devotion, they start to isolate themselves. They spend more time in the room. They sleep a lot, eat a lot. And when these things start to happen, you look at them. One of the things that you can seriously look at, how they get attracted to sweet things. Anybody who uses cannabis, you see that they are looking for muscatella, Coca-Cola, sugarcane, amamu, those things immediately.
Why is that?
Well, unless of course they explain, they have given some explanation that I have not bought. So when you see them doing those things and the language that they speak, most likely they tend to be the voice for the voiceless, preaching righteousness. And sometimes when they start, a child that is not usually a very neat person, because he knows that when he said that when you smoke marijuana, you go mad, they tend to be neater. But after some time, they lose that one too. Then they have difficulty with eye-to-eye contact. They don't like it. They don't like eye-to-eye contact 1 minute. They don't want you to look into their faces. One of the things that the parents should look at also is, if you see your child using dresses that you have not bought for them, you should be very careful. And when you see all these things put together, try quietly to be looking for match pieces, go to their room, look into their pockets, and then find out one or two things. And now, if your son also has been changing friends, is not able to stay with one friend, it is an indication that he might be doing something that the friends are not liking. So you need to look at those things. That is for cannabis. But for heroin, when you graduate to heroin, there's something we call sweet nodding. When you smoke heroin, as we are standing here, or any of the opiates, you'll be nodding. We call it sweet nodding. And even if you are holding a book, it will not fall, but you'll still be nodding. You'll still be nodding because it's a depressant, like injection petidine, like any other depressant. For cocaine, there are other signs that you can see for heroin. I don't know whether time is allowing it. When you look at the incisors, these two teeth of the heroin and the cocaine user, it's usually ashy. There's some sort of ashy there. And then the skin color becomes clammy. Have you seen a hippopotamus coming from water before? That type of skin. And they usually feel cold, and there's itching.
Okay.
They have itching. That's for both of them. But for the cocaine user, they become hyper because it's a stimulant. And when they smoke cocaine right now, you see they become very active doing certain things. And so in the ghetto, sometimes they call themselves, they are doing Zoom Lion. They can get up and be swimming. They sweep everything. They want to put everything. They are looking for things that are not there. Very restless. They buy things and share. You see, those are the things. But for, like, alcohol, people use garlic and the rest to kill the aroma of alcohol. But your walking would expose you. The rate at which you are talking, if you are naturally an introvert, and then you tend to be an extrovert, talking blah, 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 it's an exposure. So it is not very difficult for mothers to know.
But my worry today, and I've been saying this a lot these days, that people are not parenting anymore. Families are not really together anymore.
Yeah.
We value cash more than our children.
Yes.
Wake up early, around 4 o'clock a.m., leave the children, go to the market. You don't know what the children will go through. They will come, by the time they will come around 8, 9, 10 p.m., the children will be asleep. So they are chasing the money more than their children. They may leave the children to their nanny, or sometimes they will leave everything on the table. The driver will come and pick their children to school. So we went to one of the senior high schools, and one complained. The child went, it was a 4-year time, to the 4th year. The mother or the father has never visited him into the school.
Wow.
Is the child going to school? Is he doing the things he has to do? Pay money, everything is being paid. But the child has not. She was saying, Madam, if we come, if it's visitor, I don't get any visitor. My mom is not here. My father has never stepped into the school. So if you're a parent like that, think about it. Are you really parenting your child? Well, whatever you do, you're going to give account to it in the final judgment. So are you parenting your child the way he or she should be, as the Bible says, or the Quran says? We have to be very careful.
It's hard. Parenting is a big issue.
But it's not only the issue of the absence of parenting. It is not. Even the style of parenting also does contribute to the use of drugs. Like we all learned in our small psychology and sociology, there's the laissez-faire attitude of bringing up children. There's the autocratic way of bringing up children. If you are not very careful, you bring up personalities that grow to become addicted to drugs. There's a whole lot of things explaining this thing. Let's say, for example, you are the person. Why most students in a second cycle institution start to use drugs? This is what I'm explaining to you. When you are from the home where you are trained autocratically, then you take orders from senior figures, and then you must not take any initiative on yourself. You listen to orders from elderly and seniors. When you go to secondary school, it gets easier for you to take all orders from seniors, and that's how people start. A senior directs you to do something, you don't question it, you don't quiz it, you don't question it. All you know that you have been trained is that do before you complain. So you must take what the senior directs you to do, and that is how it begins in most secondary schools. They respect. But those from the laissez-faire attitude too, even though they have been given the opportunity to explore the environment and make informed decisions and take initiative in most of the things, sometimes it becomes a problem. They risk out of curiosity because they want to explore the environment. In the course of exploring, some of the psychoactive that does not take you long to get addicted to. You move far from experimentation to addiction. So that is where there's a blend between the two, a middle line where you give the chance and where you put your feet down, then we have to. But when you take both extremes, it becomes a problem. It becomes a problem.
So I know that's one issue that we haven't gone to, because I asked the question of how easy it is to come out of it. But let me also ask, I know that you do the education in the schools and everything. Do you think that parents should on their own also begin to educate their children on these hard drugs? Because we don't mention it at all.
Yes.
In most of the homes.
Yes. In some homes that Mr. Megashi was saying, it's like when you mention that, then it's something it should not be mentioned in the house. That is not good. If a parent or a sibling is training the child, asking questions and trying to answer the questions, because children, they are very curious. They may go hear it somewhere, and since you didn't tell them, they will not like to tell you too. But if you are an open type, you ask, what did you learn? What have you heard? And you get to know more. then you advise, yes, this is what they said. That is a myth. It is not true. This is the reality of the issue. Because they have several myths, especially on the marijuana. Children, when you go to schools, they say they can make you learn, you be very fast and everything. Those are all myths. So you have to correct the child that is not it. The reality of the issue is this. So that the child said, no, when I said that, my mom said, or my sister said that, or my father said it, that means what my father said is right.
So, Mr. Menkashe, if your child is not asking you, can you introduce a subject?
Who educates who? That's the question. What do the parents know about drug that the boys and girls don't know? Are they going to be giving them myths? Where somebody tells me that, yes, for you to prevent measles, a mother, you need to start giving the child alcohol. What are we talking about? So what we need to do, that the parents must also be educated to educate their children.
Yes.
The forum should not be created for only the children, but it must be all-inclusive. The parents are educated on these things. And it will interest you to know that as we are talking about drugs, it is not those who are educated, most of them do not know even about drugs.
It's true. I agree.
Because the perception, there's this argument that you need to take a little of alcohol, otherwise we're going to die on the theater table because your alcohol level, the blood
they say
alcohol
every
level,
system needs a little of alcohol. Yes.
And then the myth that you need cannabis to improve your intellectual capacity, these are not true. Scientifically, they are not true. A whole lot of things are happening. You see people drinking but still performing. Because certain areas have not yet been affected. And then a whole lot of things. And on the airwaves now, people are advocating for cannabis. People are advocating for other drugs. And we don't know what else they are not going to advocate for. Are you getting the argument? So I keep saying that there's a need for parents to be educated. In fact, this is with all apologies. There are those of us who are also in the health sector who do not know about drug addiction to the extent of managing it. There are challenges we are developing, and NACOP is leading.
Because, you know, I think the thing is, when you hear of marijuana, when you hear of cocaine, heroin, it's like the name itself, we don't go beyond, so what is it? What does it do? It's just the things that we've heard about. Hey, when you smoke it, you go mad. You know, can you tell a child simply that and it's okay?
No. Now let's get this in. Now, NACOP and psychologist. I'm an addiction professional. I have read psychology severally. But there are certain things that we need to look at critically and look at those consuming this information. That is it's very important. When I see the audience that I'm going to talk to as an educator, the audience determines what I say at certain times. We are not saying that we should hide all the truth from this thing, but you need to be very careful. Because some people have even seen their own brothers started using cannabis, gone off their sin, but they still go. They're doubting Thomases because they believe that that thing that happened to him cannot happen to me. Even though they have the same blood. So probably he did not smoke well, because there are instances where people say the seed in the marijuana is the one that you don't have to smoke. You smoke only the leaf. When you smoke the seed, you go mad. There are people who are advocating that those who smoke marijuana already have genetic psychotic predisposition. That is why they smoke, and it is uncovered. A whole lot of things are going there. So it is very important for us to educate our youth. But I think it is we educate almost everybody, including the parents, because that is the basic unit. The family is the basic unit of society. When parents are made to know the science of symptoms of using drugs, all the drugs, they are made to know how to talk to the children, not to harass them, to run away and go and hide and do them more. Talk to them. I think things will be getting better. But in the area of treatment, people come out.
Yeah.
1,001 of people completely.
I heard that in coming out, you still have to give them, doses of it.
That is the fallacy to the highest level.
Really?
You know what? Yeah, that is a misconception, a fallacy that some of the drug addicts would want you to do. Let me share something with you on this particular. There was one hard drug user who the friends had come from outside. They were ready to help. When he got to the clinic, he said that I should give him 5 cedis to go and smoke for the last before he starts the treatment. I said, we don't do it like that. I said, you're stupid. What do you know? He mentioned big doctors who have, and I knew it was a lie, who anytime he wants to watch. Then I asked, then why? They gave you the opportunity. Why are you here now? If it had worked for you there, why I wouldn't? Then he said he wanted to buy beans. And I said, okay, let's one of the nurses buy the beans. Then he said he was not going to eat again. So, but we don't, anybody who has gotten hooked onto drugs, you don't give that person the same drug in small quantities. Because once you get to the stage of addiction, once you touch it, you cannot control it. Even when you are 20 years sober, and you think that I have not been drinking alcohol for some time now, about 23 years now, I don't drink. This July is 23 years that I've stopped drinking. I cannot make that mistake that, yes, I'm treating people of addiction. I'm teaching addiction. I know about addiction, so I can now go and gamble with a thought or a bottle of beer. Because I'm not going to move from the stage of dependency to experimentation. I'm still there. The disease is there in the latent form. It only needs a jog, a thought to uncover it. And then you are as worse as you left it, and even worse than you have let it. Therefore, that thing is owning something. There are drugs that are given by the doctors to help you go through the withdrawal period. It is the fear of withdrawal, the pain that you go through when you don't have the drugs. That is what makes people to continue using. Therefore, it is the doctor's duty to give you medications that will help you to go through the withdrawal period comfortably, but not to give you that drug. You can't go and say you are going to get a detoxification from heroin, then they'll give you some heroin boosters. No.
That's good education.
Yes.
I mean, because they said it.
So
how long do you stay in the clinic, depending on what you've been addicted to?
Now, that is client specific, and it depends upon the years that you have used and the complications that might have gotten associated with it.
Okay.
We have people who have only substance use disorders. That's the new term for addiction. They have substance use disorders alone. They don't have any medical complication at the time that you are meeting them. And they don't have psychotic complication or psychiatric complication at the time that you are meeting them. Therefore, their duration of treatment gets shorter. But if you have a client that has used drugs and has complications, like the liver, have other things, it is no longer only alcohol problem. You understand? There's a need for specialists to look at the liver and all those things before you come to the inability to control and stop using the drugs. So it takes a longer time.
Okay.
Somebody uses cannabis and develops cannabis-induced psychosis. We-induced psychosis. Yes, you'll be helping the person to quit using the marijuana, but there is a damage caused, and the psychiatrist must attend to that. All those things come into play to determine the duration. You understand? So yes, internationally, and there are different types of treatment. We have the residential and the non-residential treatment. The durations vary, and it is client. Let's say it is client dependent. People can stop using drugs on the average at around 3 months. It should be okay, especially if they don't have any co-occurring condition, medical or psychological complication.
What do you say is best? An individual voluntarily coming forward, or somebody bringing the person?
That is a good question. And that has been a debate until recently. People tend to agree to some of us who have been in the field for years. Now, those who volunteer for treatment are not necessarily the best clients.
Yeah.
That is a wrong perception. Listen, some people who volunteer only come because they feel threatened. Probably they are fearing the rejection of parents. There's a threat of divorce, a threat of job loss, and they are afraid of medical implications of their drug use. So the volunteerism is not necessarily out of the blue. It is because of something. So once those things are corrected, they go back using. They don't see addiction as the problem. You see, so people volunteer because they realize that, no, if I don't do this, like wife is telling you that if you don't stop drinking, I'll leave.
I'll leave. They'll lose something.
I'll leave. So they volunteer as a way of winning back the love. But the intention is not actually to quit. There are people who are forced into treatment and they tend to be the best of clients. So there's no direct proportion between volunteerism and recovery from addiction. No, it changes.
Mabel, does NACOP care about rehabilitation centers?
Oh yes, we do. We visit as well. I told you we had the counseling team. We visit the rehab centers as well as the psychiatric hospitals.
Do we even have proper rehab centers in Ghana? You know how in America, especially, you hear in Hollywood that somebody's going to rehab. It's as if it's a, like it's a polished thing, like it's a nice thing. It's cool to go to rehab. Can we say that about Ghana? Do we have nice places?
Unfortunately, the government we don't have any public or government drug rehab center in Ghana. We don't have it. It's all private. And we have good, we have Pantan. Yeah.
Oh, so we have a rehab center at Pantai. But because it's a psychiatric hospital,
yes, the stigma.
Let
me talk about the rehabilitation centers that you are talking about. And those countries that you are talking about, they're far ahead of us in so many. So we can see. And I must answer, and because I have had a long relationship with Narcotics Control Board, and I must say that in the area of rehabilitation, they are trying very much. In addition to going to rehab centers to do their counseling and the rest, they are very, very, very instrumental in the training of people as drug addiction counselors. They organize trainings over the years. As we speak, there are some trainings going on from America. They come to train those of us who are already in the system.
Okay.
And they make us do international exams, certified for drug addiction management. So in the area of, that is why the focus is now more on demand reduction. You have two prongs. We have the supply reduction and demand reduction. And these young ladies who are here, they are for demand reduction. Education, prevention, treatment, rehabilitation.
Yeah. Are we seeing results of the work that you've been doing as well?
Yeah, we visit to take feedback. We're seeing that.
Okay. So, Ms. Amagashi,
to the rehabilitation centers, we have rehabilitation centers.
I was just saying that, can we boast of, cool rehab centers that you can sit here today and say
there's an old adage,
checking into a rehab.
There's an old adage that says that seeing is believing. When you walk to Compassion Rehabilitation Center now, the one that is started by Action Chapel, you will like it.
Yeah, I'll take
you have the WC and everything, tile floors and everything.
Yeah.
You can go there. When you go to Pantan Rehab, yes, go to House of St. Francis. It is not bad.
Okay.
They are not bad. Yeah, so.
But are all these centers easily accessible?
They are.
Okay.
They are easily accessible,
all right.
Yes.
So, because we have to wrap up, how many people do you see in a day or a week or a month?
At the Addictive Diseases Unit, it's a cyclical or seasonal thing.
Okay.
There are certain times of the year, like in June now, immediately after June, the number of cases will increase.
Why?
The weather brings himself.
Oh, okay.
And then after festivities, Xmas, those festivities, people go beyond, and then they start to have problems, and then they come. Even though within these phases, we have cases coming.
Do you have a lot of women?
The ratio of representation in the clinics is about 1 to 100.
Okay.
But that is not representative of outside, because as I speak to you, women are rubbing their shoulders with us when it comes to alcohol.
What men can do, women can do
better. But they don't come to the hospitals because of stigma.
Maybe one final thing. It's interesting because we're not advertising alcohol the way we used to advertise. You would have thought that the use of it, even with cannabis, we're not advertising at all, but people still use it. So is advertisement still a challenge?
Well, let's look at it this way. The question, it should have been, does alcohol adverts make more people to use alcohol? No. Because when you go to the villages, the hamlets and the rest, listen, some of them do not have TV and the rest. But they drink more than those in the cities who are having the TVs and the rest. You visit. Because there are no recreational facilities and all they know, go and come, and that is part of conviviality. That's part of life.
Maybe boredom makes people also.
So it is not necessarily a matter of advert. Our elite children in homes who see this thing, they associate the beer with that flashy car. With the belief that when you drink that beer, you may grow up to buy that car. That is a small percentage of people who, that is a psychological way of marketing. So the children say that he's drinking this and he has this car. So it's just like somebody who says that he wants to be an armed robber in one of my counseling sessions. Why? Because the armed robber that they show him has some car.
Yes,
so that is the association. Are you getting that?
I get you.
So
I get you.
I don't think there is any positive correlation between advertisement and the use of the drug. It might contribute, but not a strong one.
Okay. All right. I think I've taken so much from you. We have to call it a wrap. Johnson Abraham in Tama says smokers take sweet things because they feel constant heartburns. Are you talking from experience? My friend MD Kwesima says, I will suggest that in this day and age when technology is available and most kids have access to mobile phones, groups like these should create an interactive and anonymous platform which will be easily accessible by the youth. It should start in schools and spread out. If students know it is there and anonymous, it will encourage participation. As he said, morality hinders people to approach with these sort of things. So if there is no face to the name, it will encourage them. This culture should be cultivated and encouraged. Here's one. This person says, okay, is it related? No, not exactly. So I'm not going to read it now. This one says, how can we stop the youth from drug abuse if we still produce and plant drugs in this country? May God change our mentality. That's from Tiku inside Angloga. And I would have to, stop here. One final one. I have a friend who smokes cannabis and he says it makes him last longer in bed. How do we advise such a person who is already addicted, but he's very normal? So finally, is there, like a certain platform, a website or a number or anything?
Yes, we started that in schools.
Okay.
When you go educate them, we have the anti-drug clubs. We have that thing, and we're training the teachers or the staff so that one person will be the coordinator for the group.
Okay.
They will try to educate and they'll try to solve problems. If it's beyond them, they'll employ us and we will do that.
All right.
We started that anti-drug club in schools.
Okay. All right. Mr. Logosu Amagashi, I am grateful for your time this morning. I should have you more often.
Thank you.
Yeah. And of course, Mabel Jedu from the...
I wanted to add something.
Yes.
Every 26th June is World Drug Day, and this year, our celebration, doing it Saturday. The national one will be in Ho, Water region, but the regional one, we're going to do it tomorrow, that is Saturday, at Mandela Park, Ashaman, from 10 a.m. to 12:30 p.m. And Sunday will be at Shiashi, Calvary Baptist Church, from 8 a.m. to 10:30 a.m. So you're inviting all to come celebrate with us. The National Day Against Drug.
All right.
You hear more of it, and more pictures will be shown of the arrest and dreadful consequences of traffickers.
All right. Thank you, Mabel. When we come back, Reverend Dr. Samuel Kisiedu has been missing for a very long time. He's here with us on our show. A lot of people look forward to marriage. And when we started the show, we said that somebody said God should not come now because he hasn't gotten married yet. It's almost everybody's wildest wish. But is this institution of marriage what people outside think it is? Is it what people dream it is? Reverend Kisiedu will join me up next here on the show.